going to look at the unfractionated heparin. So the first question is what is the metabolism, and second one is monitoring required for the unfractionized heparin. So in this video we'll find the answers to these questions and learn in detail. So to begin with the unfractionated heparin, we are looking at the structure. The structure, it is a glycosaminoglycan. So it is a glycosaminoglycan. And what are the other features? It consists of a long saccharide chains. There's a long saccharide chains. Next, what is the factor 10A inhibition? So the factor 10A inhibition. So here the factor 10A inhibition, the answer is yes, there is a factor 10A inhibition. Then what about the factor 2A inhibition? The factor 2A. So if we look at the factor 2A inhibition, yes, there is the factor 2A inhibition, and here it is 10A is equal to the 2A. So the long chain, it acts XA and 2A, that is 10A and 2A equally. So it acts equally. Then we move on to the bioavailability aspect. So what is the bioavailability? So in terms of the bioavailability, so the bioavailability is that it is oral. In case of oral, it is not absorbed. It is not absorbed. And then when you look at the in oral, it is not absorbed. And then in case of SC, that is subcutaneous, it is not good. In subcutaneous, it is not good. And the longer chains are not well absorbed. So the longer chains, if you see, they are not well absorbed. So this is another feature. And next one we see at IV. So what about IV? The IV, if you see, it is good. Then we look at the variable response. So what about the variable response? So in terms of the variable response, the answer is yes. And then looking at metabolism. So what about metabolism? So metabolism, it is nothing but it is cleared by the RES, that is reticuloendothelial system. Next, there is the safety in renal disease. What about safety in renal disease? So it is safe. It is safe in case of the renal impairment. In case of renal impairment, it is absolutely safe. Next, we look at monitoring. So what about the monitor? So in terms of monitoring, it is required. So it is required, and this is with the ABTT. And then what about the protamine sulfate as antidote? The protamine sulfate as the antidote. What about it? So it is the protamine sulfate as antidote. It is result in the full reversal. There is full reversal. Then in case of the risk of the heparin induced thrombocytopenia. So the heparin induced thrombocytopenia. So this it leads to its high. And what about the risk of osteoporosis? So the osteoporosis, the risk is present. So there can be chances of the osteoporosis. So now we'll go on to answering our question. So the first question we asked here was, what is the metabolism? So how is the metabolism of this unfractionized heparin? So the metabolism here, it is by the reticuloendothelial system, that is a RES. Then when we look at the monitoring, so should it be monitored or how is it monitored? So the monitoring is required, and it is along with the ABTT. So this was about the unfractionized heparin. To learn more, please do subscribe.